Okay, we're going to talk about erectile function and erectile dysfunction. So this is a conversation with my wife, I don't know, about 20 years ago. And I said to her, what's your number one fantasy? I'm trying to be nice. And she says, that you would become impotent. I said, you know what? That's never going to happen. I'm going to become a vegan. All right? It's the best thing you could do to protect yourself from becoming impotent. The carotid arteries in the neck that go up to the brain are about 6 millimeters in diameter. The coronary arteries of the heart, they're about half that, about 3 millimeters in diameter. The pudendal arteries, pudendal comes from the Latin word like pudere, means shame, you know, covering the genitals. The pudendal arteries are about 1.5 millimeters in diameter. So what does that mean? What that means is these are very small arteries, 1.5 millimeters in diameter. There's 1 millimeter in each, 25 millimeters in an inch. So 1 millimeter is very small. And these can plug up very easily with just a small amount of atherosclerosis. And that's why it's very common that a guy becomes impotent first before he develops clinically symptomatic coronary artery disease or stroke. And you don't want to become impotent. Once that artery stenoses, the guy might be impotent. So stenosis is to become narrowed. But once it occludes, it might be very difficult for him ever to get back sexual potency. So the best thing to do is prevent it. John McDougall, MD, is a very famous nutrition doctor, perhaps the best nutrition doctor in the world. And he tells a story of working as an internal medicine doctor in Hawaii in the 1970s, where he was taking care of rich people in the city who eat a lot of meat and processed food, and taking care of manual laborers who ate more of a traditional plant-based diet. And he had the observation that the manual laborers would retire at about 65 years of age, and then the guys that were unmarried, they'd go to the Philippines, get a young bride, and they'd raise a whole other family with no Viagra back in those days. And they would live out their lives and raise a whole new family, raise the children into adulthood. Versus his patients in the city, a lot of them are typical meat-eating, processed food eating. They call it SAD, Standard American Diet. They're fat. Lots of diabetes, lots of impotence, lots of coronary artery disease, lots of cancer, lots of stroke, all this stuff. So that's where we're at in the modern world. People who eat plant foods, often their traditional endemic diets, relatively healthy, good arterial function, a lack of hypertension and atherosclerotic disease. Meat eating, processed food eating communities, tremendous amounts of obesity, diabetes, fatty liver, coronary artery disease, cerebral vascular disease. Okay, also when the erectile dysfunction medicine started coming out, a lot of middle-aged wives were not so happy. You know, their husbands are all getting all excited, creating more work for the wives. And what I'm trying to say is the best thing to prevent ever becoming impotent or have it delayed until your elderly years is this plant-based diet. Some men experience a Lazarus-like experience where the Johnson comes back to life. It certainly becomes better able to do what it's made to do. More persistent, strong erections, and they like that, the men do. Okay, lots of men nowadays are becoming impotent in their 30s, 40s, and 50s due to atherosclerotic disease. There's other factors that relate to this. A man should not be putting his phone in his front pocket. Men who keep their phone in their front pocket, they've got lower sperm counts. Men that keep it in their back pocket, there's some, I'm not sure yet if it's proven, but there's some association potentially. Some people claim, I don't know for sure if it's true, that keeping it down in your back pocket in here might increase your risk of rectal or colorectal cancer. I don't know if that's true, but I've heard that. Certainly, I don't think it's a smart move keeping your phone in your front pocket over your breast. Theoretically, that might increase the risk of breast cancer. I don't know. And a lot of guys, they sit with a laptop down on their crotch. I don't think that's a good idea. It's probably associated with lowered sperm counts. Okay, so the other thing, you don't need to be wearing real tight pants. You know, you pull the testicles up closer to the body, they stay warmer. They're not going to make as much testosterone. Okay, let's see. What else we're going to say here? Well, you know what I'm going to tell you. The diet that is the best for blood supply to the heart, coronary artery disease, is the same one that's going to be best for blood supply to the Johnson. Low in fat, because fat impairs blood flow. Low in sodium, because sodium is a vasoconstrictor, constricts arteries, causes hypertension. Decreased tissue perfusion. 100% plant-based, only plant food, no meat, not one bite. No oil, not one drop. And these are the same things that Caldwell Esselstyn, MD, recommends. He's the guy out of the Cleveland Clinic who has the best results in the world for prevention of coronary artery disease. He wrote the famous book, Prevent and Reverse Heart Disease. It's a great book. I went and actually trained with the guy. He's for real. He's got the best results of any doctor in the whole world for the prevention of coronary artery disease. I don't think he usually says low sodium, but I would definitely add that. I've studied sodium a lot. It's not a friend of good blood supply. I also say no caffeine. Caffeine, it increases the same hormones as stress, which means it's going to increase platelet activation, be predisposed to clotting. It's also going to increase factor VIII, antihemophilic factor. It's also going to increase fibrinogen, which is a bridging molecule, sticks the red blood cells together. Anything that predisposes to clotting predisposes to atherosclerosis. We'll talk about this in another talk, but I can let you know, cholesterol theory is just a subset of atherosclerosis. Atherosclerosis is initiated by the formation of a blood clot on the wall of an artery, and that is typically initiated by hypertension causing abnormal blood flow at bifurcations. That's where atherosclerosis typically begins to form, okay? That's another topic, but the bottom line is you don't want hypertension, okay? Try to improve your sleeping because, lack of sleep and caffeine, they both manifest as stress equivalents, increasing cortisol and increasing the catecholamine hormones, epinephrine and norepinephrine, which is the same thing as adrenaline and noradrenaline. So, anyways, the good news is quite a few men can have a big improvement in their blood flow to the Johnson and erectile performance with these pieces of advice here, so hopefully that'll be helpful.